The winner of the TechCrunch Startup Battlefield Australia 2017,
That's the year.
let's hope there's more, is
HealthMatch.
Congratulations. Congratulations. Absolutely. Congratulations.
5 years into med school and working in a brain cancer lab, I watched patients struggle with access to clinical trials. With their lives on the line and with no other options, they face the daunting task of navigating and interpreting these complex clinical trial registries. And whilst clinical trials introduce new therapies and improve the lives of millions, only 1 in 5 recruit enough participants. That's $30 billion spent on inefficient patient recruitment that we should instead be using to find more cures. When I searched for a clinical trial as a lung cancer patient, I received 373 different results, each with their own eligibility criteria. For each of these 370 forms, I need to answer questions separately and in repetitive ways. Do you have high blood pressure? Are you hypertensive? Is your blood pressure over 160 on 80? It's a terribly inefficient and frustrating process, and most patients give up. Today at Startup Battlefield Australia, we're launching HealthMatch. Well, we launched it about 7 hours ago. And HealthMatch matches patients' medical profiles to clinical trials. Our platform is powered by a proprietary API that renders this complex medical criteria in a machine-readable format and matches that to secured patient data. I'd like to introduce you to Aaron, and Aaron's a doctor turned software engineer, and he's going to help us run through the demo. So can we switch to demo? Today we'll take you on the journey of a pancreatic cancer patient looking for a trial. The core of the HealthMatch algorithm is in our ability to rapidly match patients with minimal information requirements. And achieving this level of efficiency is not merely a black box of machine learning, but rather a tiered approach beginning with fundamental computer science. At its foundation is a set of efficient algorithms that cull the question pool based on a user's prior answers, and aggregate statistics describing the prevalence of these clinical findings allow us to prioritize questions in an information theoretic manner and thin this pool even further. The secret sauce lies in our ability to cross-reference trials, and in doing so, we can proactively screen our existing users for potential matches as new trials are added to the platform. The technology is built so that it can be used in hospitals and plugged directly into electronic medical health records. If a user is unaware of a question, they can simply skip it and we can perform a partial match. And as you can see, in an efficient time frame, we now have 2 potential matches. Can we return to presentation, please? The sponsors of clinical trials currently spend on average $5,000 per patient with a match success rate of less than 20%. These traditional recruiters, known as contract research organizations, the Quintiles, Cerner, they focus their time and resources trying to get doctors to recruit. Market research companies such as Antidote, well, they're set up as a data play for pharma, collecting patient information and telling these pharmaceutical companies where to spend their money. In all of the above, the patient comes last. At HealthMatch, we're taking a new approach. We're putting the patient first, and we're bringing clinical trials to them. In doing so, our patient-centered approach translates into more effective recruitment that saves these pharma companies time and money by bringing drugs to the market sooner. In the last 6 months leading to our launch, we've already secured a commercial deal with Roche Pharmaceuticals and Foundation Medicine, and we've been working with them to understand our customers and build this patient-centered product. We have over 3,000 patients in our wait list waiting to be matched to trials. And our platform is always free for patients. The pricing model works by charging either a per patient referral fee or through an annual commercial license to the platform, and these vary between 500K to 2.5 million, depending on the size of our client and the number of trials they run in the region. It may seem like a large number, but we're saving pharmaceutical companies 2 to 3 times what they're currently spending. $30 billion is spent globally on clinical trial recruitment, and in the short term, we plan to target 5% of this market. We're launching initially in Australia and New Zealand, covering 12 medical conditions that vary from cancer to Alzheimer's, and these conditions represent 80% of that market. We've partnered with key patient support groups, such as the Lung Foundation and Purple Our World, and it is through these strategic partnerships that we have access to a distribution list of over 500,000 patients in Australia. So HealthMatch is live. Experience seamless clinical trial matching today by visiting healthmatchapp.com, and let's find more cures. Thank you.
Great. Thank you, HealthMatch. Over to you, judges. Who would like to go first?
So how do you plan to recruit patients into using the app?
Yeah, so we've taken a few different approaches.